Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada. Hi, everyone. Thank you for joining us for another extraordinary Action on Pain podcast. My name is Jennifer Daly-Cyr, and I'm coming to you from Ottawa today. So great to be back in studio. And I want to send, before we introduce our special guests today, I do want to send a special thank you to my co-hosts, Virginia and Keith, for always being these amazing partners. And frankly, over the last several weeks, they've been doing a lot of filling in for me as I care for ailing parents and my own health challenges. So, as I always like to say, teamwork makes the dream work. And I just want to thank you very much for everything that you do.
Well, Jennifer, that's amazing. Thank you. Appreciate that. And we're just glad we're able to support you. So my name is Virginia McIntyre, and I'm joining from Nova Scotia. And I'm thrilled to have our guest today. I had the opportunity to join both these guests at the Canadian Pain Society National Pain Rounds and talk about the Canadian Pain Society strategic plan, and had the opportunity to work with both of them over the last couple of years with the Canadian Pain Society. And she's been doing amazing work.
And I'm Keith Meldrum, and I'm the West Coast connection on this little group called Action on Pain podcast. So coming from Kelowna, and like you, Jen, it's always great to be back in studio, and especially with this interview. Really looking forward to a conversation with these two amazing people, who I both have a lot of respect for both of them, and really looking forward to what they're going to be sharing with us today. So with that, I'm going to introduce our two guests. Today we are joined by Dr. Tania Di Renna and Dr. Hance Clarke. So thank you for being here today. Dr. Di Renna is an associate professor at the University of Toronto, Department of Anesthesiology and Pain Medicine, and she completed her medical school anesthesiology residency training in Ottawa. She obtained a chronic pain fellowship at St. Michael's Hospital in Toronto as well. She is the medical director of the Toronto Academic Pain Medicine Institute, called TAMPME. TAMPME is the largest pain partnership that includes 5 academic hospitals in the Toronto area. She practices anesthesiology and chronic pelvic pain at Women's College Hospital. She served as the co-chair of the Health Quality Ontario Guidelines for Chronic Pain and as the co-chair of the Ontario Chronic Pain Network. Dr. Di Renna is a board member of the International Association for the Study of Pain, the Abdominal and Pelvic Pain Special Interest Group, and is also the president-elect of the Canadian Pain Society. Dr. Hance Clarke is a staff anesthesiologist and the Director of Pain Services at the Pain Research Unit at the Toronto General Hospital. Dr. Clarke is currently the Knowledge Translation Chair for the University of Toronto Centre for the Study of Pain and a professor in the Department of Anesthesiology and Pain Medicine at the University of Toronto. Dr. Clarke holds the Good Hope Ehlers-Danlos Syndrome Chair in Translational Medicine and a Tier 2 Canada Research Chair in Chronic Pain, Mental Health, and Substance Use. Dr. Clarke has been recognized internationally for the development of the Toronto General Hospital Transitional Pain Service. He is the president of the Canadian Pain Society and the past president of the Canadian Consortium for the Investigation of Cannabinoids. He has authored over 250 peer-reviewed publications and has been invited to speak on pain control, cannabis, and the opioid crisis to the House of Commons in Ottawa and elsewhere around the world. I think everybody listening can agree that we have two absolutely incredible people joining us today, and we're so excited they're here to represent the Canadian Pain Society. So thank you for taking time to join us today.
Pleasure, Keith.
So we're going to get right into this. So first of all, I'd like to learn a little more about how you feel the Canadian Pain Society is aligning and supports the action plan for pain in Canada. Now, we know there's a lot under this action plan, a lot that the Canadian Pain Society does. So Dr. Clarke, I want to start with you.
Sure. Thanks for the question, Virginia. It's really clear that when we look at where we are in Canada as a result of the Canadian Pain Task Force document, we've got specific angles that we need to align with. And clearly on a national level, that's kind of where we sit in terms of this discussion. And the pillars here are, how do we improve patient access? How do we ensure that we have equitable care? and obviously research and generating data to improve policy long term. And I think from a Canadian pain perspective, pain society perspective, we're in the best place we've ever been. One, as a society, we are much stronger than we've ever been. And it was the perfect time, we'll get there, to develop a strategic plan. So maybe, I'm going to flip it to Dr. Di Renna just in terms of maybe diving in a little deeper in terms of where she sees our strengths.
Makes sense. And thanks all of you for inviting me for this discussion. I really feel like the CPS's responsibility is a few of the goals that are written in the action plan for pain, because I think we have kind of a strong education mandate for healthcare providers as well as the research piece. So goal 3, for instance, is people who live with pain, and health professionals have the knowledge, skills, and educational supports to appropriately assess and manage pain-based population needs. And it's at the CPS where a lot of people who don't do research, even community clinicians, come and learn about what needs to be done and how the needle needs to be moved further in some spaces, right? And so it is that forum that people come together and learn about what should they be doing next for pain. Because as I mentioned before, pain care can't stay stagnant, right? It's got to move forward. And then the other piece is to also align the needs of scientists and the researchers that make up a lot of the membership of the CPS. And so the goal number 4 is pain research and related infrastructure enables discovery, catalyzes innovation, and results in translation of knowledge into real world impact. And so these 2 goals, I think, are fundamentally important of what the CPS should be doing. And that's why we started the strategy, right? We started realizing that there was a cycle of, researchers and then clinicians and then researchers taking over leadership at CPS. And so the goals seem to be changing every time somebody new came into the leadership. And so we said, hey, let's create a strategy so that at least if there's a change in leadership, we still have some common threads in what we should be delivering to CPS members and Canadians who live with chronic pain.
That's a very interesting. I love how you've just been able to show that really CPS as an organization as a whole broadly really is in lockstep, I would say, with the action plan. You specifically spoke to goals 3 and 4. I love the fact, Dr. Di Renna, you talked about you have some members who are not sort of on the research side. And so this is a great opportunity for them with their peers to be educated on that and how it can better their practice. And then you touched on something we really want to talk to you about, and something I'm very, very interested in because I'm such a nerd. I just can't help it. Strategic planning. I'm all about that stuff. Plans and CPS, you've gone through a very comprehensive sort of internal organizational review, and you've come forward with your strategic plan. And you touched on it as to why, but we'd really like to dig into that more. And again, you've touched on some of these things, but why now? What does it mean today? And what does it mean going forward for CPS with this strategic plan?
So I'll probably touch on why now, because she does become our leader after the Quebec City meeting in the spring, which will be, one of the most amazing meetings we ever had.
You bet.
Of course. That being said, what I did before I landed here was actually take a look through the Pain Canada website and say, okay, what have we started? What's complete? Nothing was complete, but things are probably getting close to complete. But there are certain things that they claim have not been started. And so I think the CPS can be very, can take some responsibility to help get some of these things started. And the things that I see that we have already started that haven't made it to the pain tracker are one, it was a clear directive from our stakeholders that one, meetings in person were important. And during COVID, we had thought that we could just continue to run virtual meetings and keep the society rolling. But 85% of our membership said, no, these meetings are important. The other thing folks said were that we need some upskilling of our profession-specific kind of disciplines. And so, we've had a big appetite to improve things and create new special interest groups and things of that nature. We're going to be doing some of that. And, what I'll say is, when you look at some of the other areas that claim to not have been started, I think they have been. So we are, developing various pockets across the country are developing chronic pain Indigenous facing toolkits. We're developing modules for physicians to help them interact with some of those populations. I would say from a veterans perspective, I'll let Dr. Di Renna share, but she's been, discussing women and veterans pain and all of these other areas with the CPCOE and some of the other folks in this ecosystem. So in terms of today and now, we've got a clear directive that these meetings are important, that continuing to elevate the ecosystem, push for policy change, engage with the federal government, these are all things that are on the platform now for the Canadian Pain Society.
Thanks, Hance. I think Hance kind of elucidated our whole fourth pillar, which is the purpose of us as an institution is to really strengthen the relationships between the researchers, the clinicians, and with the people with lived experience. One of the greatest feedback that we got from last year's meeting was that sit-down session with trainees and PWLEs, right? This is where they really hear, and you guys know my Pontiac Aztec theory about creating programs and learning is that you have to involve the people who are going to drive the car if you want to sell the car. And so, or else you make the Pontiac Aztec, which never sold. So the idea behind creating that engagement with CPS members, and we've also increased PWLE membership for CPS thanks to you guys. And so you could kind of see the pieces being put together. So the CPS strategy, one of the pillars is engagement, right? Giving people value and creating these collaborations between all of the entities that exist, right? Because when you look around, there's CPN, there's Pain Canada, there's us as CPS, there's the CPCOE, there's SKIP, the pediatric groups, et cetera, the CIHR, the Health Canada piece that looks at specifically at chronic pain. So it's kind of nice for us to be putting them all together in one room, just virtually, not via email, but putting people physically together. So that was one of the pillars. And we have little goals, and then hopefully we'll be able to tick off all of these goals by the time, the next group of leadership comes in. It's a 6-year term, right? 2 years of pre-president-elect, 2 years of presidency, and then 2 years of past presidency. So it's a very long term, but hopefully we can kind of tick off some of the goals. And I just listed one of the pillars, but I'll let you keep talking, Virginia, because you know me, I could take over a conversation.
And what I love, I like Keith. I absolutely adore strategic planning. It's just, I don't know, in my blood or something. It's just a thing I enjoy, value it tremendously, and was so appreciative to see this strategic planning process happening with the Canadian Pain Society this year. I thought it was fabulous. And knowing and seeing for us, the people with lived experience, seeing an actual pillar that had mention of it there, knowing what has led to it, it feels to me like this is kind of a turning point for the Canadian Pain Society. Is that a fair assessment, do you feel?
I would think so. Absolutely, Jennifer. I think, once again, I want to reiterate that I think we're in a position where we've probably not been for quite some time. And we are being reached out to, pretty consistently by the policymakers, by the federal government, by media, just to figure out, what's happening at that healthcare level, at the patient level. And they always want to hear our patients beside us and talk to us and talk with us, right, in terms of what's happening. And so I think it really is a unique place. And the key here was to ensure that whoever began running the show and comes in after Tania had, that runway to understand this is what we've committed to as an organization. There's no sharp right turns or 90-degree moves. We are continued to be focused on improving the lives of patients living with pain. And that's the 8 million Canadians on a daily basis.
I love that. And I've got to go back to sort of my nerdy analogy, but my background has been in civil construction. I built roads and bridges and stuff. And hence what you've shared with, why today, I've seen you as a designer, looking at it from a construction standpoint, you've looked at what is the task. And the first thing you've decided is you need to build the foundation. If you don't have a strong foundation, anything you put on top of it fails. So the foundation, you've built that foundation. So going forward, it might need to be tweaked as you build it, but you've got a solid foundation based on the input from the people who are your members. What do they want? What's important to them? And I think you've given this platform and that runway, as you said, to say, here's the direction of this organization. Because CPS, the Canadian Pain Society, is Canada's national organization that speaks for your healthcare providers and people living with pain. And I just love the work that you've done, and you've laid out that roadmap to say, whoever comes along, here's your playbook. And I think it's critically important for today. Really interested to know what you guys think about for tomorrow and down the road with this.
Yeah, and I'm going to pass that to Tania, Keith, but I'll tell you that this was her brainchild. I know you spoke to her about TABME, but strategic planning is what she does. I hear it's what Jennifer does. Certainly was not what I was used to, but getting through the process, I see and I understand the importance of having a vision for an organization. Because one of the biggest criticisms we had before this was the fact that, well, how do we make a long-term partnership? Because we don't know who's next, or we don't know where this organization is. And we've been quite lucky over the past 6 years to have pretty like-minded leaders, and hopefully that continues to be the same. But if it isn't, at least there is a roadmap that hopefully leaders are beholden to that keep us on the path that we're on. So for the future, I'll pass it on to the next president of the society.
Love it.
I do want to say one thing, and just to get a plug in there for it. And you said, you listen to the members. And I just want our listeners to know members are not just researchers and academias and clinicians. It is people with lived experience. And, I'm really proud to see what CPS has done to really integrate the voices of people with lived experience. I'm kind of curious, how are you going to measure the outcomes of this?
Always asking the hard questions, Virginia. That's why, strategic plans work really well with little goals. And so you can create, like my job here today at TAPME is to create, we create a scorecard and we say, hey, how many meetings have you had where actually there's been some mentorship and mentors and mentees have been connected to each other? How many meetings have you had with residents and PWLEs sitting together side by side? It almost pushes you to not forget that part about the meeting and to be accountable to what's sitting in here. So taking these goals and really creating kind of a scorecard type measurements is probably going to be the next step in terms of the knowledge translation and the rollout piece and how we measure if we're successful.
That's great. That's fabulous. And on that note, I would suggest that you could even add into that. I'm thinking about the annual scientific meeting in Toronto this past year and how completely evident it was that the discussion was happening to include people with lived experience, and that it was a part of most, if not all, discussions throughout the weekend of the conference. And I just congratulate you both on that.
Thank you. I appreciate that, Jennifer, because it's hard. It's hard to organize a conference. I didn't know until I took this position on about the very delicate balance between making sure you're satisfying people with lived experience, making sure you're satisfying the needs of the people who are here to learn, and the people that are here to expose their research. So it's a really delicate game to try to make everybody happy. And we've been trying to listen and be very humble about what people's needs are. Because I think that's sustainability, right? This is how we're going to be relevant. We're 50 years old. We need to stay relevant to people. And also organizational consistency. So if we say, hey, this is what we really find important, we have to make these particular groups happy, then you can be guaranteed that no matter who takes over the leadership in a few years from now, those are going to be the same pillars that they're going to be using.
You talk about the ASM. So I got a question for you. We got ASM to be in Quebec this year in 2026. What do members can expect? We have a new strategic plan. We have things. What can members expect this year in Quebec?
So we're ramping up right now, Virginia. The good thing is, just like in Toronto, we had the opportunity to have a local organizing committee. And so, the QPRN will be involved in kind of curating some local opportunities, events, having people familiar with the city. And we're going to be ending midday Saturday, so people can actually go and enjoy Quebec City during that time and plan some things. Maybe bring their partners, bring their families, bring their children, and really get to explore one of the most beautiful cities in the country. And so I think that is going to be certainly unique. We will be handing over, obviously, the reins to Dr. Di Renna. So we will probably go back to having another dinner on that Friday night. And there's going to be, I don't want to let it out of the bag, but I think we're going to try to put together a bit of an online presence where we even outdo what we've done in the past with seeing some folks tuning in from around the world, potentially, to see what we're doing in Canada. And Canada's leading the world. And I know I sound biased, I clearly am. But, if you have an event where over 100,000 people come or 200,000 people come, that's a big deal. That means people are noticing what you're doing. And so we'll see how this all comes together. But I really think it comes back to, we are Canadian. We should be buying Canadian. This is Dr. Di Renna's take. And we should be actually ensuring that all of us, and you look across the landscape of what's happening in pain in this country, whether it's pediatric pain, whether it's pain and substance use, whether it's just pain and mental health, anxiety, depression, pain at the core level of neuropathic guidelines and what we should do from a clinical practice perspective. we're leaders across this space, across the globe. So we should be bringing this home and bringing this to Canadian soil and not always chasing the rest of the globe, so that we are completely unified here in this country and supporting our national organization. The more of us that bring it here, we continue to strengthen it. If you look at our journal, our Canadian Journal of Pain, it's now well over a 3 point something impact factor. And Joel Katz has done a great job with that. And that will continue to climb with the quality of papers that come in. We now get basic science papers in there as well. It took a long time for our basic scientists to say, hey, we want to engage. So we're there. The ecosystem's there. The scaffolding is there, as Keith said. And now it's just continuing to move forward with all of the pieces hopefully aligned.
One of the things that I can say I have the opportunity, I'm fortunate in some of the work that I do. I work with other individuals and organizations across the globe. Repeatedly, I hear the statement, what you're doing in Canada is leading. We want to be more like Canada in the pain field.
Yeah.
I heard it once or twice and I thought, oh, well, was that I hear it consistently. So to hear what you say, Hance, I think it's great, to focus on Canada, but know that the world is watching Canada and saying, we want to do what they're doing. So, Tania, no stress on your shoulders going forward. There's, the world's watching as you take this organization forward. In strategic planning, sometimes we talk about the big hairy idea. It's those crazy ideas you throw at the wall and you say, like, if I could do anything, what would it be? Where do you see, you've got a great foundation, you've laid out the roadmap, but do you have any thoughts on, like, what do you want CPS to be? Like, what's the great big idea? Where would you like it to land? That's a loaded question, just so you know.
Man, you're so naughty. It's a huge question, but increased engagement of PWLEs, I think, board level, that type of stuff. You never know, pie in the sky, PWLE leadership, like in terms of leading the CPS, we are really far ahead of the game. Like, we had a women in leadership panel last year with international people coming, standing room only at the CPS. And that same talk is being replicated in Bangkok and Thailand with a whole bunch of female leaders putting their hand up thinking, this is a wonderful idea. Why don't we think about this? So we are, like as Hance said, we are leaders. So we really need to think outside of the box. So Canadians really do best. And we're trying to encourage people to say, when you don't come to the CPS, please don't tell us it's because you went to a meeting in another country. You're coming now. Everyone's going to come and see us. So that's the idea, is that we're going to be knowledge holders for the rest of the world in terms of chronic pain management. We do a great job. We have lots of passionate people. Our people with lived experience, our researchers, our clinicians, we're super passionate. You could see how much time we invest in organizing things. I think we just really need to think out of the box. That's where I want to see us, is practical, like all Canadians, and moving things forward and thinking outside of the box, like all Canadians. And Canada first.
Well, for throwing up a really loaded question at you, I think you knocked that right out of the park. And it's wonderful. And I've said it before, I'm like Jen and Virginia, just really excited to see the work that your organization did in the strategic plan. I know they're never easy. Like you said, Tania, it just in everything, you're always trying to balance the needs of everybody. It's a tightrope that you walk because there's always competing interests and they're all of value. So, but a strategic plan gives you sort of that guidebook and that plan. Because if you don't have a plan, you don't have a roadmap, you don't know where you're going. And I think what you've built now is that roadmap forward. So huge congratulations on what you've done. I'm excited to be on the outside watching CPS continue to grow and be the shining light of pain management, education, inclusivity, not only in Canada, but throughout the world.
Let me correct you there, Keith. I don't think you're on the outside.
Well,
I think
well,
you're not in an outside position in any ways.
Well, I appreciate that, Hance. Thank you.
That's amazing.
I was just thinking one more thing, if we get added to the big scary idea or hairy idea, you said, you mentioned the Journal of Pain in Canada. Wouldn't it be awesome if someday people with lived experience were primary authors on that?
Yeah, that would be amazing.
Yeah. That's a great idea.
Nothing would stop that.
Yeah.
Good addition. And so I'd like to thank Dr. Tania Di Renna and Dr. Clarke for their time today and their expertise. It is always a pleasure to talk with you both. And I look forward to our next time we chat.
Thanks so much.
Thank you. Thanks for having us.
It was an absolute pleasure, guys. Thank you.
And we'd like to thank all of our listeners for tuning in to the Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada as guided by Health Canada's and Action Plan for Pain in Canada. Until next time. Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.